Hey there, how's it going today? Lisa here from the Cupping Revolution. I'm just checking in here today to have a conversation about some of the current health concerns that are in discussion regarding COVID-19 and cupping therapy. So I have seen this coming up in my news feed, also in my Facebook group, the Cupping Revolution, questions and concerns and comments about performing cupping therapy during the pandemic. And I just wanted to touch on a couple of points regarding cupping therapy. So, first of all, I would like to just discuss the cleaning and disinfection protocol. So, COVID-19 virus is actually killed very easily with a very low level disinfectant. Hand washing, as we know, is a good defense as well. So, in terms of killing the bacteria for COVID-19, or sorry, the virus for COVID-19, you actually don't have a lot of concerns around that as long as you're performing the proper disinfection protocols. So, not to worry about that. The standards of disinfection that we promote with the cupping revolution is high level disinfection, and this will more than take care of the COVID-19 virus. So rest assured you're covered there. Secondly, and probably most importantly, actually, is some of the research on the symptoms and the effects of the COVID-19 virus, which is a bigger concern for practitioners. Even though massage therapy and a number of other bodywork modalities are contraindicated for any kind of clotting disorder. So I think one thing that needs to be probably more clearly defined is that at this point in time, based on the research that we have, we probably need to say that COVID-19 is considered a clotting disorder, which means if someone has or even has recovered from COVID-19, they would be contraindicated for cupping therapy. Now, the problem with this is that there are so many people apparently who are completely asymptomatic with the COVID-19 virus. So when our clients are coming in and we're doing our preliminary check and our extra questionnaire, it's important not only to ask them if they have been diagnosed with or tested positive for COVID-19, but I would even consider extending that to if they suspect that they may have been exposed to or that they may have be asymptomatic. Personally, I would also add to that a waiver form that states clearly that COVID-19 is a clotting disorder, or it's clotting is a symptom, coagulation of blood is a symptom of COVID-19. And so therefore, if a person is carrying the virus, that there is a particular concern with cupping therapy, and have them sign that, and then you should be covered. So far, we haven't had any incidences where cupping therapy has created harm because of coagulation related to COVID-19, but it's very, very early, and we hope that that never happens. So that would be the best safe practice that you could do to cover yourself for any asymptomatic cases, but also just generally treating or using cupping therapy right now. So I don't want people to be afraid to practice cupping because, as we know, it's such an amazing condition and there's so many symptoms and problems that can be treated so effectively with cupping therapy. So keep cupping, cup smart, be cautious. The only other thing that I would add here is obviously it also depends on the type of cupping that you're performing. So if you are doing lymphatic cupping and you're cupping on a very superficial level, I don't think you have a lot of concerns. If you're doing a deeper myofascial cupping or joint mobilizations or deeper work on the back or on the legs, on the muscles, then there may be slightly more room for concern. So the risk of harm increases with the depth of suction of the cups. Again, so if you are particularly concerned about a client and they really want cupping and they haven't tested and you may be suspicious, you can err on the side of caution and treat more lightly, and you should be okay. But just be aware of these concerns and make sure you cup safely and try to find a little light in every day. That's the best we can do right now. Okay. Have a great day. Blessings. Bye.